Good afternoon, everybody, and I'm joined today by Commodoro Young, the head of the Vaccine Operations Centre. The news this week is important for Australians, and I want to thank over 880,000 Australians who have come forward to create a record vaccination week in Australia. In particular, 807 people were vaccinated over the course of the last 7 days. That's an increase of 48,000 over the previous best week, and what it shows is that Australians have confidence in the vaccination program, Australians are keen to be vaccinated, and Australians are coming forward to be vaccinated. This is, I think, a very important step. In particular, we have now passed 8.25 million vaccinations in Australia. The number is 8,255,473 vaccinations. And taken together, what we're seeing is a significant increase in rises across first doses and second doses. First doses are at 6,348,000 with 30.8%, and second doses are now 1.87 million, over 9.1%. And very significantly, 53.8% of over 50s, 62.7% of over 60s, and perhaps most importantly, 70.8% of over 70s. But we want to encourage all Australians to come forward at the earliest possible time as they're eligible. Please do not wait, and people have been magnificent in the last week and in previous weeks. The fact that we've now had a record week at the same time as we see new channels opening up with additional supplies of vaccine arriving and being distributed. This week, over 500 general practices will commence distribution of Pfizer, and Eric will give you more detail on that, and that will build over the course of the month and then build over the final months of the year. And so these additional sources are based on additional vaccines, and we've seen record numbers of the current supplies, but as we have increased supplies this month, that's a very promising sign for the future. In particular, I also want to address cases in Australia. We've had 38 cases officially in the 24 hours to midnight last night. Obviously, states and territories will announce additional cases after that. That's 35 in New South Wales, 3 in Queensland. I'm aware of subsequent announcements. And I would also particularly want to address Summit Care, Baulkham Hills aged care facility in New South Wales. Every aged care facility in New South Wales has had 2 doses, and around the country of the Commonwealth residential aged care facilities, 2,566 facilities, all have had first doses. 2,565 have had second doses. One facility had a flu late last week, and so that will be completed once the flu is cleared in the coming days. In particular, though, with regards to Summit Care, our advice is that we have 5 residents that have been diagnosed as positive. All, on the advice that I have, are asymptomatic. All have or are being transferred, nevertheless, to hospital for observation and isolation. And of those, 4 have been vaccinated, 1 is unvaccinated. What we know from our care in Victoria is the advice I have from our Victorian Aged Care Response Coordinator, Anne Smith, today. All of those 3 residents who were positive here are now on the path to return and recovery. 1 has returned home, having been cleared. The second has been cleared of the virus and is due to return home today. And the third is being treated in hospital for other conditions, but is expected to be home over the course of the coming week. And that's a very positive example of the way in which this program is helping to protect Australians. We're not immune, but we are well prepared, and what we've seen in particular with Summit Care is clinical first responders on site, partnership between New South Wales Health and the Commonwealth, and in particular the local health district, and the Public Health Unit in New South Wales. We've made sure that there is communication which is being done by the facility with the families on the advice that I have in terms of daily updates, and in particular very close clinical supervision with additional support for the workforce to provide additional support for the residents. Obviously the facility itself is in lockdown. There's a specific focus on the area where the residents have been, and all residents have been tested on 2 occasions, and across the facility 149 residents, and the advice is all bar 4 were vaccinated. So I do want to thank Australians. Each week brings challenges, but most significantly what we have seen is a record week, 880,000 vaccinations, and this week expansion of the program with additional supplies and additional points of presence through the general practices, who will primarily work with by reaching out to their own patients, and that will progressively expand. And in order to talk about the rollout and the expansion, Commodoro Young.
Thank you, Minister, and good afternoon, everybody. As the Minister said, last week was a record with 880,000 doses of vaccine administered across the country, taking our total now to 8,255,473 doses administered. That included a record day last Thursday of 163,178 doses recorded in a single day, on our way to 8 million reached last Friday. In New South Wales last week, 278,000 doses of vaccine were administered through a combination of state and Commonwealth clinics, and in New South Wales we now have 50% of those aged 50 and above who have now received at least 1 dose of vaccine, and 67% of those aged 70 above having received at least 1 dose of vaccine. It took us 47 days to get to our first million doses of vaccine administered, and just 8 days to reach our most recent. And that milestone gives us an opportunity to stop and thank everyone across the supply chain that makes that possible. That includes those people producing the vaccines, Pfizer, AstraZeneca and CSL, our distribution partners, DHL and Linfox, and I'll add into that the Royal Flying Doctor Service, which has provided support over the last couple of weeks, our vaccine service providers, International SOS, Sonic, Healthcare Australia and Aspen Medical, and the thousands and thousands of healthcare professionals who turn up every single day to vaccinate Australians, as well as the many hundreds of people in the National COVID Vaccine Task Force and our counterparts at both the Commonwealth and state and territory levels. In addition to reflecting on where we've come, the milestone also gives us an opportunity to reflect on what we need to do. As the Minister said, this week we'll see a boost to our program through 2 primary fronts. Firstly, we'll be increasing community pharmacy rollout. The community pharmacies are specifically designed to provide access in areas where there's little to no GP support in remote, rural and regional areas. And this week we'll have 65 community pharmacies administering vaccine across Queensland, the Northern Territory and Western Australia, and that will ramp up to approximately 300 by the end of July. Secondly, again, as the Minister said, we'll see now a progressive transition of our Commonwealth vaccination sites to administering the Pfizer vaccine. This week we have 505 general practices administering the Pfizer vaccine, 62 Commonwealth vaccination centres and 15 Aboriginal community controlled health services. By the end of this month we'll have over 1,300 general practices administering Pfizer, all of the Commonwealth vaccination centres, and by mid-August we'll have all of the Aboriginal community controlled health services administering Pfizer. In terms of operational update, I'll cover that in 3 parts, focusing on the supply of the vaccine, the distribution of the vaccine and administering of the vaccine. In terms of supply, last week we conducted batch released and sample testing of 305,370 doses of Pfizer vaccine and 704,000 doses of AstraZeneca vaccine. In the coming days, the Therapeutic Goods Administration will conduct sample testing and batch release a further 300,000 doses of the Pfizer vaccine and 260,100 doses of the onshore CSL manufactured AstraZeneca vaccine. In terms of distribution of the vaccine, last week we distributed 1,108,000 doses of vaccine to more than 2,500 locations across the country. Every single one of those deliveries were made, and despite lockdowns causing a number of flights to be cancelled, we even managed to use the Royal Flying Doctor Service to ensure that deliveries were made to a number of remote and rural areas in the Territory. In terms of administering, we already talked about the figures last week, 880,000 doses administered across the country, taking our total now to 8,255,473. That's an increase of 100,000 doses from the previous week. An analysis of that data indicates our weekday average increase of 16,000 per weekday, up from the previous week, predominantly on the back of increase in second doses. And I'd like to take the opportunity again to thank everyone who's coming forward to receive a second dose. This week, for the first time, we saw second doses surpass first doses. 443,000 second doses were administered, of which 241,000 were AstraZeneca. With our vaccine service providers, we continue to focus on those most risk in our society, those older Australians in residential aged care facilities. As the Minister said, all 2,566 residential aged care facilities across the country have received a first and second dose visit. In New South Wales, all 883 residential aged care facilities have received a first and second dose visits, and our focus now is on the conduct of roving clinics. Roving clinics are designed to head back to a facility that has received a first dose visit and offer vaccines to those who may not have chosen to take a vaccine up the first time round. We've now conducted 79 roving clinics in New South Wales, and we have another 156 scheduled to be completed by the 17th of July. As we complete the the residential aged care facilities, we will start to roll our vaccine service providers and continue ramping up the disability sector. We now have 12,521 people with a disability in a residential setting having received at least one dose of vaccine. This week, like we do every week, we want to ensure that all eligible Australians know how and where to access a vaccine. And again, I'll point everyone to the eligibility checker on the health website at health.gov.au, where they can access, and we've had more than now 12.9 million visits to that website. But today, like we do every single day, our focus is ensuring the vaccines we have are available across the country where and when they're most needed to protect more Australians. Thank you.
Thank you very much. Happy to start with questions. I'll begin, if I may, with those on the phone. Chloe.
Thank you, Minister. I have two questions. The first, Queensland's still pushing for a quarantine facility at Toowoomba. Is there any chance that the Commonwealth will get on board with this? And second of all, the former Prime Minister Kevin Rudd is today calling for your resignation of the vaccines and quarantine. What do you have to say to the former PM?
So to the first one, the answer is no, that's not deemed a suitable facility at Toowoomba. And indeed, I've spoken with the local member, Garth Hamilton, today, who's reaffirmed the strong, overwhelming view of the local community against it. But we are working very constructively with Queensland. The Pinkenba base is being considered. Queensland has stepped forward on that, so I think that's a very positive step. Then in relation to the second one, I haven't read the article. Madura.
Thanks, Minister. Just on Queensland again, the Queensland Health Minister today said, the state rollout is only getting 63,500 doses of Pfizer a week all the way through July and August. There's a big bank up of people who have booked in for a vaccine or want to book in for a vaccine. What do you say to leaders who, like Greg Hazard, who said trying to get doses like the Hunger Games? What do you say to people like them?
Look, we work very constructively with all of the states and territories. In terms of Queensland, we'll go from approximately 232,000 doses of Pfizer in June to 430,000 doses, so an increase of almost 198,000 over the course of July, and I think that's a really significant increase. So an increase for Queensland of almost 198,000, and if I may, I'll give you the numbers for New South Wales. For New South Wales, we'll go from 400,000 in June to 682,000, so an increase of 282,000. There were some additional supplies provided to New South Wales in June, and so those figures were higher than the baseline might otherwise have been. So nevertheless, an increase of 282,000. And so what that shows is we were able to achieve record results, record vaccinations with the combination of AstraZeneca and, as Eric has said, very high second doses, which is really heartening, and Pfizer. And just this month in each of those two jurisdictions, an extra nearly 198,000 Pfizer doses in Queensland and an extra 282,000 Pfizer doses in New South Wales. So I think all of the states and territories, they're all doing heavy lifting. We appreciate it. The backbone of the program, of course, has been the GP program. We see at this point in time that the Commonwealth programs have delivered 4.7 million doses, the state programs 3.55 million, but all of them, all of the different channels are pitching in. Olivia.
Thanks, Minister. New South Wales Health Minister Brad Hazzard has likened the chase for available vaccines to the Hunger Games. What's your response to this? And just secondly, your colleague Tim Wilson has identified a sort of 60% as a vaccine threshold to clear the first stage of the roadmap to the return to normality. What's your personal opinion on this? And do you think any potential vaccine threshold should apply to adults or the entire population?
Sure. Look, in relation to vaccines, it is the most competitive global environment imaginable. And through the course of this, we've been fortunate to ensure that there was sovereign domestic manufacturing, and that's seen at this point in time over 5 million AstraZeneca vaccines delivered, including 4.3 million of those as first doses. And that means that we're in a very strong position to have absolute security of supply over the rest of the AstraZeneca program. And then internationally, we have 40 million Pfizer that are due this year. We have 10 million Moderna that are due this year, and we have an order of 51 million Novavax, and we're expecting the first arrivals of that to occur in the last quarter of the year at this stage. We're hopeful for earlier, but we would put the conservative expectation of the last quarter of the year. And it is incredible the result that we had of 880,000 doses last week with what we have in Australia. That shows that the distribution system is working. It's a global challenge. Australia's part of it. It's just that our challenge is different from others. In a world of well over 2.1 million lives lost this year, at this stage, no Australian has caught COVID and lost their lives in Australia. The vaccination program is part of those great global challenges, but for us, to see a record week is a strong indication. In terms of thresholds, that's been referred, and it's very, very much understandable for anybody to have an opinion, but our approach has been to follow the medical advice. That work is being done by the amazing world-leading Doherty Institute here in my home state of Victoria. They're doing that work, and we'll continue to work with the Doherty Institute, the Chief Medical Officer and the Chief Health Officers around Australia. Josh.
Yeah, thanks, Minister. Since the conflicting messages we heard last week between federal and state governments on vaccine, we've seen a spike in anti-vaxxer activity online, including some groups encouraging aged care workers to go on strike and even protesting outside the offices of government MPs in Melbourne. Is it unhelpful when we've got comments like those which came from Queensland last week? And what more can be done to combat this, online misinformation and give more people more assurances around the safety of the vaccines?
Sure. Let me outrightly condemn the anti-vaxxers in Australia. Yep, I've had them protest outside my office on different occasions, but the real damage they do is by spreading falsehoods and undermining people's confidence. But the truth is, Australians are great vaccinators. what we've seen is that our childhood vaccination rates are some of the highest in the world, at over 95%. And we're seeing strong confidence in Australia. And I would encourage everybody to have confidence in vaccination. It's a pretty simple equation. Vaccination for COVID can save your life. If you catch COVID, you can die. And vaccination is your best protection against that. Then with regards to the Commonwealth and the states, look, we just work constructively. And I understand there will be voices or opinions from different time. Our goal is really simple, and I think it's the mission that Eric first defined, to ensure that as many people are vaccinated as early as possible. Then Andrew.
G'day. Just going back to Olivia's question about thresholds, given issues around things like hesitancy and stuff like that and anti-vaxxer movements, can we be is it wise to set sort of like a hard, arbitrary sort of numbers of like 80%, 70%, whatever? Is it better, or is it better to set a sort of thresholds for reopening on basis of, everyone who wants a vaccine can have a vaccine?
So,
and secondly, what's the current thinking around children being vaccinated, given some of the views of epidemiologists and what we're seeing with Delta?
Sure. Look, in relation to children, the TGA is currently assessing an application from Pfizer. They are very, whilst they work at the fastest possible pace, they work to the fastest possible safe pace. And so they're doing that assessment, and once they've completed all of their safety assessments, then they'll make their decision. And so I'll respectively won't preempt that, but that's the only application of which I'm aware at this stage for children. Others may be forthcoming, but I believe they're looking at 12 to 15-year-olds. But again, that will be a TGA process, and they will run to the point of working through all of the safety assessments, all of the efficacy assessments, and then making their independent findings.